We now know, we just found this out, that 500, in fact, over 500 family doctors have now left the province's public system. And that's only since the beginning of last year. And this, of course, the problem is, it's not that they've left and decided to necessarily go elsewhere, but to go into the private system at a time when there are now over 700 vacant positions in that system. One of the questions is, why is this happening? And I guess the follow-up to that would be, what can we do to stop it, if anything? Dr. Vincent Charbonneau is Vice President of Quebec's Federation of General Practitioners. He is on the line. Doctor, thank you for your time this afternoon. Let me pose that first question to you. Why do you think this is happening?
Hi, good afternoon. It is a situation that is complex, that concerns us, because it talks about the capacity of the healthcare system in Quebec to attract and to keep its professional. We talk here about family doctor, but we could talk also about nurse practitioner, psychologists that are also going practicing in the private. So we see this trend that where there is more and more family doctor choosing to practice out of the system, and for us it tells us that we don't put in place what is necessary in the public system to attract them and to retain them. We have to say that in Quebec we do have a lot of constraints in working on the public health system. We have the regional physician resources plan that could limit some people to work in some region. We also have the special medical activity that also constrain doctor to practice sometime in field that they don't want to practice. So some people look for other options, and they could go practice in other province or anywhere else in the world, but they also decide now to go work in the private system. So we say we need to work on the condition on the public healthcare system to make sure it's more effective and to bring them back.
So it sounds to me that money's clearly not the issue here, but the working conditions are.
I mean, there are probably 500 different reasons why people go out of the system, but our evaluation is that it's mostly because of question of quality of life. For example, somebody whose husband, for example, could only work in Montreal, Toronto, or Calgary. If he does not get a place in the regional physician resource plan, he will in Montreal. He will look for adoption. He will go in another province, or now he can see this option to go in private. So those constraints in the system bring some people to make some choice. We are also concerned because of the burden of work on the shoulder of family doctor and the public healthcare system. We know that we have asked a lot from family doctor, and the perception is that we always ask more. So I think for some people it's a way to control their workload and to make sure that they do what they like. They like to see patients, help them, do what they have studied for, and to be proud of that, and not always have the impression that we ask more and more from them, and we don't recognize the good job that they do. So I think we have to take that into consideration, because we know family physician as an issue all across Canada. We have difficulty to attract medical students into this specialty. Just in Quebec, when we talk about the and I will correct myself because I said it in another station, it's around 600 places that were on field in the last 10 years.
Okay.
So if we would have been attractive enough in family medicine in the last decade, we would have between 500 and 600 more family doctors in the system, and maybe those who left would not have left if those new doctors would be there in the system. So we have to make sure that family medicine is more attractive, so that students who go into medicine choose the specialty. We have to make sure that the burden of work is not too hard, so that people who work in the public system don't find it too difficult and decide to leave. And we also have to make sure that because we have a lot of doctors who are close to retirement who follow up a lot of patients, we put the condition in place to keep them as long as we can.
You know, Christian Dubé obviously has a big job ahead of him trying to figure out exactly what's going on with the healthcare system in general. But as far as doctors go, and correct me if I'm wrong, I know the idea is to try to be able to produce, if we can, more doctors just generally here. But the problem with that is that doesn't happen in a year or two. That's going to take time. Is there a different way or a different option we can to attract more people here from other places across the country?
Yeah, for sure. I mean, the first thing is the good decision has been made to increase the number of spots in medicine in general. Our concern is that after 4 or 5 years, those medical students need to choose family medicine because we won't solve the problem even though there's more students. If they decide not to choose family medicine, we won't help with the problem. For sure, we also have to be very attractive for doctors from other provinces, but from all over the world. And I know there's a lot of work that is done related to that. We have to be realistic that other provinces also look for family doctor, and other country in the world also does look for those precious resources. So, but you're right. We need to be more attractive for doctor for other from other places to come. And our constraint in Quebec make it more difficult for them because the same constraint that apply to physicians in Quebec apply to those who want to come. So they first they need to speak French, but they also need to have a place in the regional physician resources plan.
That's the PREM.
That's another constraint that and they have to feel their special medical activity. So, for example, the doctor could choose to go, if we go back to private, he could choose to go in private because he want to do primary care, something that we need in our system. He want to do full-time primary care. But with the constraint that we have, he can go in a place and be said, you can do primary care, that's good, but half of your time or part of your time, you'll have to go work somewhere else in the system to help. So that's another constraint that we have on our doctor, and that is there also for another difficulty when we try to attract doctor from other place in the country or around the world.
To what you just said, please help me, because I heard this from someone not that long ago, that there are some doctors in the system who work publicly and then decide they can work outside the system as well when it's appropriate for them to do so. So in other words, you're getting the best of both systems. Does this happen on a regular basis?
To be honest, I'm not a specialist of that. From my comprehension, for a doctor, it's not possible to do both. It's possible for a nurse practitioner or other healthcare provider. But for family medicine, you have to choose, or you work in the system or you work out of the system.
Okay. So I think what I'd like to ask with regards, again, you spoke about control, and I'm thinking about the PREM and things that might make it more appealing. I mean, what would it take to fix this situation? Can't we I mean, I understand why the PREM is in place. I understand why some of these constraints are there, but we need to make a change. Where should we start, Dr. Charbonneau?
Exactly. I think first of all, we need to look at those constraints, see how we can make them less important. We also have to make sure that the condition of work in the system is more interesting, that we recognize better. We value family medicine. We recognize the work that is done, and also that we compensate appropriately compared to other specialty in our system. So there's a lot of things that we need to do to make family medicine more attractive in the system so that we can solve this problem.
Doctor, I want to thank you for your time. We appreciate it. Thanks so much.